today, I want to speak about something that many people find very difficult to discuss: the cancers of the ovary, cancers of the fallopian tubes, cancers of the womb, cancer of the cervix, also called the neck of the womb, cancer of the vagina, and then of course there's vulval cancer, which is cancer that opens on the outside. And this month, September, being a Gynecological Cancer Awareness Month, I think it's important for us to just remind each other of the importance of an openness and a desire to get prevention and talk about it. So starting with the cancers of the internal organs, which is the ovaries and the tubes. Well, these are quite difficult cancers to even suspect. They're not so common. However, when they present, they typically present quite late. The common symptoms that they present with would include a swelling of the belly, constipation, a feeling of unwellness, and very non-specific symptoms altogether. It is important, therefore, that one needs to go and get checked, maybe by a nurse or by your GP or a sonographer who can do imaging of those internal organs. That's the ovaries and the tubes. Now, coming to cancer of the womb. This is typically a cancer that happens in older women after the menopause. That's when it's very common. However, it can happen at any other time, particularly in people with other conditions like diabetes, morbid obesity, and so on, and other hormonal conditions. The common thing for cancer of the womb is bleeding. That's the commonest symptom, which is bleeding after the menopause, which we call postmenopausal bleeding. If it is somebody who's still having their periods, this can be bleeding in between your periods, or indeed sometimes very, very heavy periods with clots. Now, moving down to a cancer of the neck of the womb. Unfortunately, this is one of the commonest cancers in our region here in Southern Africa, and the leading cause of death from cancer in women. There are many reasons why this is so, but it includes the fact that our health system, even though we do have a cervical cancer screening policy, the level of reach of those services is quite patchy, and the coverage for the country varies from region to region, with very low coverage in some of the more rural areas. Well, cancer of the cervix would typically present with abnormal bleeding, or sometimes there is a feeling of a mass or swelling of the glands when it is advanced. But more commonly, it presents as bleeding. So let's take a step back and talk about this very, very common cancer. Well, what we know is that a big risk factor is infection with what we call high-risk human papillomaviruses, commonly called HPV. So the national approach to this kind of cancer starts with primary prevention. Many of you will be aware that in South Africa it is now policy that preteen girls are vaccinated against HPV. This protects them against these high-risk types of the HPV. So before the cancer develops, there are pre-cancerous conditions that we can pick up on these pap smears. And if we do pick up those kind of changes, then treatment is available. So the clinician takes a magnifying glass, applies vinegar onto the neck of the womb, and then examining it under a direct light, which would show the abnormal areas where the HPV has taken root and might be causing precancerous changes. If these precancerous areas are discovered, the clinician will be able to either cut out the area that is affected, or sometimes destroy it with cold or heat, which we call ablation. These are all very, very important ways of preventing the progression of the disease. If you do have this type of treatment, you want to have annual checks, typically up to 5 years, with repeat pap smears or further testing of the HPV virus. We see the prevention of cancer, or all gynecological cancers, as part of that very important annual check, which you can get done at a nurse near you. Many clinics now do offer pap smears, and many GPs indeed offer pap smears, and of course many specialists like us will offer pap smears as part of the general gynecological examination. So don't sit with the burden of cancer or the risk of cancer. Talk about it, be open, talk to your nurse, talk to your GP, talk to a friend that you're comfortable talking to, but at the end of the day, do get tested.